September is Blood Cancer Awareness Month, which means it's a time to raise awareness and educate communities about blood cancers. Here to tell us a bit more about this is Nurse Christina Paris from the VA. So thank you so much for joining us this morning.
Good morning. Glad to be here. We're in a little different setting.
We're switching it up. We're keeping everyone at home on their toes.
I like it.
Right, so first off, can you tell us a bit, what is blood cancer?
So when we think of cancer, it actually affects 1 in 3 people, which is kind of staggering and alarming. But we have cells. Our whole body, everything is made up of cells. Trillions of them make up our body. And as our cells age, sometimes they change and mutate, sometimes they just age and die. But when cells mutate and start to kind of clump together, they form tumors. So we can either have hematologic tumors, which are in your blood and in your immune system, or we can have solid tumors, which are what we most commonly know about, that go in our organs and whatever. So if a tumor is benign, is benign, correct, it's not cancer. And if it's malignant, that means it's cancerous. So we can have tumors that aren't cancerous in our bodies. So that's basically what it is. Then when we talk about blood cancer, we're looking at things like leukemia, lymphoma, and myeloma. So these attack either your immune cells or your bone marrow, the blood that's formed in the bone marrow. So those are the 3 biggies.
And then what are some of the predictable signs or symptoms that can come with this?
So there's lots of, feeling tired and fatigued, having any kind of unusual bruising or bleeding, any persistent fevers or night sweats, unexplained weight loss. Anytime you have unexplained weight loss, that's a huge thing that you want to, or unusual bleeding, you want to go and talk to your providers. Swollen lymph nodes, you won't probably feel a swollen liver or spleen, but your doctor can kind of touch your belly around and see if there's something.
They'd be able to tell.
Exactly. Frequent infections, so you just keep getting sick over and over again. Having bone and joint pain. We talked about the sweating, when we talked about the losing weight, feeling full after even eating a small amount of food, or if your bones break easy. So you're just walking, or you take a step and you break a bone in your ankle, or you're lifting something and you break a bone in your hand. So feeling nauseous, blurry vision, numbness, tingling, just, again, anytime you lose weight without trying that, those are big symptoms that you want to go in. You want to talk to your doctor and find out what's going on.
Right. And then how can this be treated?
So the treatments, we have the chemotherapy drugs, which they've made great strides. They're not all like they used to be, where we thought, oh gosh, I'm going to be sick forever. And some of them are pretty mild in symptoms and can be managed. And then we have immunotherapy and bone marrow transplants. Big things are, you want to talk to your provider first. You want to know what the benefits are of doing these treatments. And you want to think about what your outcome is and what your goals are in life. And that's huge. You really want to talk about those things before you get sick. Like, what do I want in life? And if I do get sick, do I just want to be comfortable? Do I want to treat it? Do I want to try to live to see, 1 more year? So you want to have all these discussions, and it's best to do it when you're healthy.
Right, and it's obviously not a one-size-fits-all treatment, especially with the way medicine has gone so far. Like, there doesn't have to be one thing.
Right, exactly. And some cancers are very slow growing, so they're not always a death sentence, but early detection is huge.
It's the best you can do sometimes.
Yep, go see your provider anytime you're just not, something's not right. You know your body the best.
Awesome. Well, thank you so much for joining us this morning, giving us a little insight on this. We always appreciate it.
Thank you.